real careful. But we do want to be.
Hi, everyone, and welcome back. Once again, Tom Slavik with Dr. Arnold Zeiderman.
Hi.
And we're talking about, I'm going to read this, Amador County Behavioral Health Advisory Board. And the board is, that's probably not where a person goes to. Where does a, say if I have some issues, okay?
That's not where the person
Everybody
goes
has
to.
issues. Let's say I've got some issues, and it dawns on me, I need some help.
Yeah.
Okay, I need to get some help. I don't know what kind of help to get. How do I get some help? What would I do? I think you would said, first of all, I would look it up in a book, well, like the phone book, or call up Health and Human Services.
You can call up the Department of Behavioral Health.
Okay.
It is within the Health and Human Services. It is a county agency, and they have resources available to see people and evaluate them and try to help them and figure out which basket they go into, okay? Whether it's a smoking thing or a drug thing or a depression thing.
Is that how we get a lot of people into help?
Well, a lot of the people, particularly people that have a Medi-Cal eligibility, they can access services there, okay? For the remainder of us, it's a little bit more of a challenge because you can't, if you don't have Medi-Cal, you really can't get seen there. So you need to really connect with your family doctor. If you feel like you have an issue in yourself or your family, which is common, about 10% of people, families, have a serious mental health problem going on at any given time. As we said earlier, 2 million people in California right now, out of the, maybe more. So you need to recognize it, whether it's your daughter or your child or your mother and father or uncle or whatever, or yourself, and you need to look for help. And most people start with their primary doctor. Okay? And primary doctors are very capable, seeing and diagnosing people, sometimes starting them on medication, but then if it's a more serious problem and the treatment is more sophisticated, they tend to refer them to a psychiatrist.
To a psychiatrist?
To a psychiatrist if they need medication, or sometimes they'll be seen by a clinical psychologist. It just depends. If you have someone with a bipolar disorder or schizophrenia, they need to be on medication, okay? They need to be on medication, and so they need a diagnosis and they need treatment by someone who's licensed. There are many disorders that don't need to be treated with that type of medication. Particularly a lot of the substance abuse issues that we have, and they're very pervasive here.
Okay, let's go a little bit back to the board. What is the board finding out about reaching people with mental issues, emotional issues that they would like to get help? Do they know who to contact? Do they feel the people in the county know who to contact? Do they?
Well,
like
I think we're trying to. I think the board is trying to see that they do that. And even though I'm not here officially representing the board today, I happen to be a member. I'm the vice president on the board, but I'm not an official spokesman for it here today. But the board's purpose is oversight. The board's purpose is to assess the needs in the community, to see and measure the services that are already being provided. And passing that information on to the Board of Supervisors so that the Board of Supervisors can be responsible and make the best decisions for allocating those resources in the community.
Does the board put out a report?
It does. It actually
goes to the board?
It actually just put out a report, and it just went to the board, and I believe the board approved it, and there was also a yearly update on the Medical Health Services Act, which is a 3-year plan, and that just went to the Board of Supervisors. Yeah, so we're doing what we're supposed to do, but we always want to do it the best that we can.
Okay, a lot of people, we have a lot of social media, we have the internet and things. Can people get a hold of the HHS on the internet and find out?
Yes.
Do you find people
you can go on the internet
that way as well?
Right, you can go on the internet, look up behavioral health services in the county. You can go on, look up Prop 63. You can look up Mental Health Services Act. You can look up the revision of the mental health. You can go to the Mental Health Services, the MHSOAC, which is the State Oversight Board. They have a website. So there's lots and lots of information out there.
Are you, as just now, as Dr. Zeiderman, who sits on the board but is aware of things that are happening, are we getting the people that should be contacting? Are they contacting you? Are they getting help? Are they reaching out?
You're talking about the citizens.
You're reaching
leading
out, but
mental
I mean, how
health?
about the people that need help? Are they
Well, I'm
coming
not
forward?
in
Do they
a
know what's
position
going on?
to answer that,
Okay.
Tom. I can't really tell you
right.
whether people are getting in or getting through or on their line. I'm not associated with that part of it.
Okay.
But I do know that I think that the people that are working in the department are doing the best that they can, with oversight. But it's tough for them to get people that are qualified to move up here and live here, take a public position. So it's a challenge, just like it is with the other health part of the health system here.
Right, and also I remember when this first started, and Susie going with the new board down there, and I think at the time they were stating like, well, there's a lot of stigma related to mental issues that people have, and it's a hard thing to overcome.
Yeah, well, stigma is the big word. It means stigma is something, it's like a bad thing associated with the mental connection of stigma. And so, and it's basically true. It's not the kind of thing people like to talk about. So when something happens, people don't bring it out versus another thing. I mean, if you were to go over to the hospital, you try to get a hold of your doctor on the weekend and you couldn't find anybody in town, you'd probably be complaining. Or if you couldn't get a service at the hospital. But when you can't get a mental health services, people don't tend to make a lot of noise about it, okay? So it's there, and we know there are a lot of people in the community that, when their families have needed it in the past, currently need access and will in the future. But again, they're not real outspoken about it. So you have to kind of draw them out. And people come up to me all the time and tell me a story about something in their family. And virtually every one of the people that I know that's actively involved with the mental health programs, there's something in their history that's motivated them, every one of them. And that's good. That's good. So if we have people in the public that feel that way and they're interested, and because if you've gone through it, you have expertise. So yes, we will have more. There should be more room on the committee if people want to be a member of it.
Okay.
And they should, if I can give them my email.
Sure.
Okay, so my email is arnyzdoc, ARNYZDOC, arnyzdoc @sbcglobal.net. Send me an email if you're interested. I'll get back to you, and then we'll see whether we can accommodate you and you can help serve the community.
Okay, I wanted to ask another question. We've just got a few minutes, but does the board also deal with criminals or people that are here, like that might need help as well, that are maybe in the county jail?
Well, actually,
seeing now that we have felons there, do we have
Martin
programs
Ryan
that we're doing for
and
this?
Todd Reeby deal with
What's that?
Martin Ryan, our sheriff.
Yes, he's on the
and
board.
Todd Reeby. No, well, actually, Martin has an appointee to the board, correct? So that's pretty much suggested in every county. There should be a tie-in with law enforcement. And I know that Todd Reeby is also concerned. So, as I said, when mental health overlaps with criminal behavior, substance abuse, homelessness, so these people end up on the street. They end up getting arrested. A mentally ill person being put in a local jail is obviously not real good. It's not a good place for them to be, okay? And there's a stifling in the court system. So, again, we need to sort of fine-tune things, try to make it work better for our elected officials, for our district attorney, for our sheriffs who deal with this stuff with people all the time. Mm-hmm. And try to pull together so we can do the best that we can. We're not alone. I mean, just
Sure.
Amador, our problems are like all of our surrounding Calaveras, El Dorado, Tuolumne. They all have problems, so we're not unique. But as rural counties with small populations, the bar is higher. It's more difficult because we don't have the critical mass for certain facilities and services. So, but we can, we want to be an example here. I would like Amador to be an example of a rural county that's successfully dealing with it. So, and that's why I appreciate you're offering me this opportunity to come on today and talk about the issue.
It's really important, and everybody not necessarily everybody, but just about everybody has difficulties sometimes, and to get professional help is a good thing. I mean, you know, if, like you said, if I broke my leg, I'd be running off to see a doctor who could set it. Okay?
Right.
And so you need to get
You got it, Tom.
get
That's,
yourself working,
that's
right?
exactly right.
And
Exactly
then
right.
get back in the game and move on, right?
Are we done, or you want any
I think
more?
we're done. We've got like 20 minutes. I'm going to give you your.
Oh, I did.
go-
I
tell-
did
give
also.
your-
I
give
did
your
want
thing
to
one more
add.
time.
Add
Go
one
ahead.
thing
Add
that
that.
there's a group
Quickly.
here that dealing with perinatal mental health issues. Pregnant women. When women are pregnant and after they deliver, they get moody. Sometimes it's a serious, life-threatening problem.
Sure.
So that's my contact with it as a
Right.
OBGYN doctor. But there is a group trying to work with the hospital called the Perinatal Oversight Committee. So for those, that's another area in which people can participate. So they ought to contact me or
There's
you.
all
and
things like that. Like
dealing-
students around, finals time get more anxiety.
Absolutely.
Than that. We all and in this economic downturn that we've been in for a long time, that's hard on people. That's hard on families. So everybody needs it. Don't worry that much about the stigma. Get yourself working right, and then
Yeah, if you got an issue in your personal life or your family,
right on.
you should try to get some help.
Okay.
You got to
we're
get
gonna,
out.
We're going to leave on that note, and so you can contact Amador County Health and Human Services. Thank you very much. Thanks, Doctor, for coming by.
Hey, good to see you.
If you want to join that board, drop Dr. Arnold Zeiderman a email. Thank you. We'll see you again next